During the Public Service Recognition Week 2022, we are celebrating 5 of our executive program alumni to gain their insights about leadership. Today, we're happy to feature Dr. Sharon Ishikawa, a research manager for mental health and recovery services at the Orange County Healthcare Agency. Sharon, glad you can join us.
Thank you for inviting me. It's a pleasure to be here.
Sharon, here's $1 million question. When your friends and family ask you what you do, what do you say?
That is $1 million question. I say I'm a research manager with the Orange County Healthcare Agency, and then see where they take it from there, and respond accordingly.
When you look at what that means on a daily basis, what would you say that you do over a course of a week of recognizing that your schedule sometimes isn't your own?
That's a really great question. I would say day to day, what my job and my team's job is all about is giving voice to our citizens' stories. They trust us with information and data, if you will, about how they're doing, how they're feeling, what they're thinking about, what's important to them, through various questions and forms. And it's so easy sometimes to think about that as an administrative tool or an administrative task. But really, the way that we view it is they're trusting us with their stories, where they are in their personal journey. And it is our responsibility and our privilege to be able to give voice to their stories so that we can find new, creative, and innovative ways to help support them in meaningful ways. So that's what our day-to-day, slogging through the day-to-day is all about, is giving voice to our people's stories.
Man, I really admire the work that you're doing because it's helping people when they need help the most in many ways, and trying to find the resources to help them live productive lives and be good members of our community. When you think about it in terms of the leadership role and things that you're doing, how do you define what public service leadership is?
That's another great question. And, I've been thinking about that. And for me, public service leadership is about being a leader or a voice and a champion of the people. And so sometimes it's about finding the balance of all the different people and communities we support and we serve, and kind of tailoring our approaches to best meet the needs of individuals, and not assume that one voice, one solution will fit all. So really kind of taking more of, more of a tailored approach. I don't know if that makes sense. Feel free to ask clarifying questions.
No, I mean, it totally does, right? When you're looking at leadership and recognizing that there's some skills that might carry across, but they also be very specific to the environments in which you operate. You've talked a lot about working with individuals. Are you tending to work with clients specifically, or are you thinking about it more in terms of what your team and office accomplishes?
We, as a research team, we're actually often a few steps removed from direct client service and interaction. Excuse me. And so when I think about how we can help really kind of amplify the voices of our communities and the people that we serve, we've been thinking about it in terms of how do we pull together our team and really kind of leverage people's strengths and their passions, where really the whole is greater than the sum of its parts. Everyone has their strengths, their skills, different backgrounds that are all valuable to bring together to be able to tell a person's story, a client's story, a program's impact. This is an opportunity for a team, a group of people to come together, leverage their skills, to have a synergy, and be able to tell a truthful, impactful, and meaningful story that helps not just the people we serve, but also the clinicians, the managers, and all of those who work within the program, as they are all working towards the same mission and goal of serving our communities.
Man, I have so many questions that are surfacing for me. Let me ask you a question about your team first. And we're looking at, how do you identify, or how do you start to identify what their strengths are? How do you do it? How do you get started?
We're just starting that process. So research within our organization, within mental health and recovery services, was just reorganized. I think with the impact and the instability that COVID bring, and the pandemic, and really, I think public service agencies everywhere, right? Our focus was on responding to the pandemic. And so now that things are stabilizing with COVID, we're now shifting our focus back into developing up this new team. And starting with that was really a question that I had asked everyone to think about, which is, what are your strengths? And what I asked them to consider when they thought about what their strengths were and are, isn't what they were necessarily just skilled at or good at or had background in. What I asked them to factor into what they considered their strength is something that gave them energy, that made them feel passionate about what they did, and what they would be working on or what they would be doing. One of the managers within HR described it to me very well, which is a strength, and this is what I kind of brought forward to the team, is to ask them to think about their strength in terms of what makes the clock stand still. So you can get into your task and you feel like you're in the zone, you've got flow going, and it gives you energy and passion and excitement. And then, as opposed to the types of tasks where you keep looking at the clock and it's standing still for a different reason, right? Where it's like you just wish like the day would be over, and it feels like it's sucking the energy out of you. I wanted to know what gave my individual team members and gives my individual team members that sense of energy and passion. So that's part of what we're looking at in terms of building upon strengths.
Oh man, I'm totally going to steal that metaphor because I love it. What makes the clock stand still when you have all the passion behind it, right? Where your day just totally disappears. And then on the reverse of that, what makes the clock stand still is saying, when is the day ever going to end?
Right.
When you're starting to get the responses back from your team members, what surprised you?
What surprised me actually is there were lots of, quote, hidden talents. And areas of expertise and a breadth of knowledge and experience that I wasn't aware of, because maybe it wasn't being asked of or tapped into given their current particular projects or tasks. And so this is part of what we'll be working with together in terms of how can we bring more of that in. I think one of the things that I was really excited about, one was not just these areas of hidden talent and experience. It opened up learning about them opened up all kinds of opportunities on where we can go next in our approach to how we explore and evaluate our programs and tell client and program stories. So we're just really kind of at the beginning stages of this, and I'm really excited to be able to start working with the supervisors and the research analysts in terms of, okay, so how do we bring this all together and move research for our service area forward in a new and exciting way.
Man, that's awesome. I know you're on the earlier side of it, which is good learning for all of us, right? Of being able to say at some point you just got to jump into it. And it sounds like you're trying something new and seeing, what can we learn from this experience? What's your gut telling you right now about possible directions where this might head based on all these hidden talents that are emerging?
Well, I think there are a few different areas, and the areas that would be kind of newest for us is moving into and really building up the data science side of what we do. Excuse me. And so we have been hiring and bringing on people with that specific skill set, and we're speaking with managers over the different service programs to find out what their needs are, what they really kind of feel is lacking, and looking to make people's jobs easier by helping to automate something, to take tasks that we have a lot of people doing, manual rote tasks that people are doing, and to automate them through the skills of our data science team. That way we'll be able to free up our staff, our people who are some of our most valuable assets, to do what they do best, which is to think and to recognize different ways of doing things differently, doing them better, or freeing up their time so that they can actually be focused on the job, on what the primary purpose of their job is, rather than tabulating, going through spreadsheets, or merging files or things like that. So we're looking to streamline manual processes to make people's jobs easier, so that they can be more efficient and feel more effective in being able to tackle their tasks, because they have the tools and resources that they need. So that's one area. I think the other area that we're looking to build up more intentionally than we have in the past is really kind of on training and tutorials around data and outcomes, and the use of the different measures and tools that we use, as well as how can these, rather than just being an administrative tool, how can these different measures actually be clinically meaningful and useful, and how can you incorporate it into your daily work with your clients and families? So we're looking to build up that arm of what we do as well, in a more intentional way.
And those are big things to tackle. When you're looking at your approach of working with the team and leveraging those strengths and starting to identify them, what from the experience so far do you want to continue to carry forward as part of the team dynamics?
You know what I would like to be sure that we continue carrying forward is their connection to program staff and managers. We're a newly kind of centralized unit, and I think part of the value and one of the strengths of the unit is that all of the research team members have come various programs within mental health and recovery services. And one of the things that would definitely, I believe, is important to carry forward is their direct connection and communication lines with program. That's how we make sure that we are understanding the data and the information, and that we are understanding the stories, if you will. If we were to exist in a bubble or a silo, I don't know that we would be able to do justice with the data in the same way. And so that would be, and thereby not doing justice to to the people that we serve, the clients we serve. And so that would be one of the things for sure that I'd like to make sure that the team is able to carry forward.
I love that. It's a very humanistic approach of focusing on relationships side of the house, being able to build up those teams. And when you think about, the work that you do from an outcome perspective, right, the research, how does that influence how the agency shows up?
Well, that's great. A great question. So we are a data-informed agency and becoming more and more so, right? And so what's the way and the value that the work that the team does is about helping to make decisions, right, in an objective way. Which programs are in need, are meeting or projected to exceed capacity and may need increased funding. For example, when volume, the volume of calls for some programs dramatically increased, we were able to really go in and do a lot of analytics work on call volume and staffing ratios, and kind of help make recommendations that we provided to program around the number of staff and the number of staff needed throughout the day, based on what appeared to be the call volume cycle for the program. So that's part of how I think we're looking to more and more support programs is give them information so that they're able to make the most informed decisions around managing their programs, both from a resource capacity, whether that's in terms of increased funding or staffing or both. And then the other side of it is also balancing that with what are some maybe technical resources, access to data dashboards, things like that, that will help their day-to-day management and operations be a little bit more seamless and easier to conduct. So those are some of the ways that we're moving towards and or continuing in the work that we do to help support our programs.
I mean, that is critically important, and we don't often think about it from an organizational standpoint that has to be generated in some way. And appreciate all your efforts in being able to do that within the Orange County system, being able to look at that data and say, how's that shaping the decisions that we're going to make in the future based on hard numbers and experiences, and not necessarily on just what our gut's telling us or what we might be inclined to do, of having something behind it. The people that are going to watch this video are in public service and leadership at different levels. What advice do you have for them when it comes to thinking about leadership within this space?
Working within this space, leading within this space, anyone who's chosen a career in public service can be a leader. And part of that, I believe, is about having the vision and the passion and the commitment to serving the public. It's not about glory or a paycheck. They're long hours. It's hard work. Sometimes it can be thankless or feel thankless, but in the end, it's because it's about supporting the people in our communities who might not have the ability to voice their needs themselves in a way that can be heard. And so we are the amplifier of their voices and making sure that they get their needs met. And anyone in public service at any level can have that vision and commitment and be that leader, regardless of what your title is.
Sharon, thanks for all that you do in advancing excellence in public service as you model, inspire, and lead the way. Appreciate your insights today.
Thank you. Thank you so much for inviting me.